Hello friends, welcome back to Learning Nails and Aesthetics. We are on we are on page 139. We will be reading to 148 in the Milady Esthetics book. Check out my other videos as well, the Milady Foundations book and the Milady Nails book. I also have fun videos, unboxing, swatching colors, and we'll be doing a lot more of that. So we are 139 to 148. Describe the symptoms of polycystic ovarian syndrome, PCOS. Polycystic ovarian syndrome, often shortened and pronounced PCOS, is a hormonal condition that affects 1 in 20 women in their childbearing years, according to the U.S. Department of Health and Human Services. It is believed to have a genetic component. Symptoms include increased antigen production that causes development of cysts on the ovaries. The cysts create irregular menstrual cycles and difficulty with fertility. Clients with PCOS are insulin resistant and have challenges with weight loss. Sleep apnea is also a symptom. The esthetician will work with the client who has PCOS because PCOS symptoms include acne, thinning hair in a male hair growth pattern of baldness, which is sparse hair density at the front and top of the scalp. It also causes abnormal hair growth on the face, arms, thighs, neck, and breasts. Clients with PCOS may feel self-conscious about their body image. They may feel they have lost control on many levels. On page 140, we're going to go back to page 139. There is an illustration, figure 4-4. And it has a picture of a lady, and it tells some of the symptoms. So, trouble conceiving or infertility, mood changes, acne, fatigue, insulin resistance, high testosterone levels, excessive body hair growth, weight changes and trouble losing weight, ovarian cysts, low sex drive, irregular or missed periods, male pattern baldness, thinning hair. All right, back to page 140. PCOS is not a condition that is cured, but symptoms can be managed. Birth control pills can help regulate the sex hormones, and androgen blocking medication can help regulate the sex hormones, and androgen... Wait a minute. Let's start that paragraph over. PCOS is not a condition that can be cured, but symptoms can be managed. Birth control pills can help regulate the sex hormones, and androgen blocking medication can help control hair growth and acne issues. Performing hair removal treatments with waxing or laser services can help keep unwanted hair under better control. Skincare treatments using ingredients that influence the formation of comedones keep the stratum corneum thin. Treatments that influence acne breakouts like microdermabrasion, high frequency, and an ultrasonic skin scrubber are helpful. Additionally, providing emotional support can help your client. Check in. Describe how an esthetician could help a client with PCOS. List common vascular conditions or disorders. Vascular conditions and disorders can be hard for a client to deal with, so it is important to understand the types to better help your clients. As mentioned earlier, these types of vascular lesions may be considered tertiary lesions. Rosacea is an inflammatory and vascular disorder with multiple causes that are not completely understood. It is a progressive disorder that starts with flushing and increasing bouts of redness. Visible vessels and skin sensitivity are symptoms. The symptoms can progress to pustular-type breakouts that can be confused with acne. Rosacea can affect the eyes as well, causing chronic bloodshot eyes, some clear to yellowish discharge, and irritation. In advanced cases, the rosacea can cause skin thickening, particularly around the nose. This symptom is called rhinopharyngoma. Rosacea can be challenging to treat because of its unclear origins. Heredity, bacteria, the dermodex mite, and fungus are possible theories. Certain factors are known to aggravate the condition. Vascular dilation of the blood vessels makes rosacea worse. Spicy foods, alcohol, caffeine, temperature extremes, heat, sun, and stress aggravate rosacea symptoms. Rosacea treatments. Like acne, estheticians can treat the symptoms of rosacea, but cannot cure the disorder. Symptom management is the goal when working with a rosacea client. Rosacea treatments should include collaboration with a medical professional. Antifungal prescription skincare products may help. Skin calming ingredients and treatments will help decrease the inflammation. Provide soothing facials with gentle massage and light exfoliation. Limit the use of steam. Adding high frequency to oxygenate the skin can help. Some advanced aesthetic procedures with lasers, intense pulse light, IPL, and radiofrequency devices can be effective. Telangiectasia is visible capillaries, 0.5 to 1 millimeter in diameter, what are commonly found on the face, particularly around the nose, cheeks, and chin. They can appear due to an injury, heredity, rosacea, hormonal changes, or exposure to extreme cold or heat. A matting of tiny telangiectasia creates a ruddy complexion called gross skin. It's a cosmetic irregularity and is not a medical condition. Varicose veins are typically vascularity. Let's start that over. Varicose veins are visible vascularity that are abnormally dilated and twisted veins that can occur anywhere on the body. They are often on the legs. Pregnancy, extended periods of time standing and sitting, and genetics are contributed factors. Sometimes treatments with sclerotherapy, an injection into the vein with a solution that causes the vein to collapse, can cause similar vessels to disappear. Varicose veins are a condition that can be treated by a medical professional. Such treatment could include surgery for large twisted vessels. Check-in. Explain the progression of rosacea. List 4 rosacea triggers. Summarize how to treat rosacea. Identify pigment disorders. The genetic background of a person influences pigmentation disorders. Abnormal pigmentation, referred to as dyschromia, can be caused by various internal and external factors. Hyperpigmentation, overproduction of pigment, and hypopigmentation, lack of pigment, are the 2 types of pigmentation disorders. Sun exposure is the biggest external cause of pigmentation disorders and can make existing pigmentation disorders worse. Drugs may also cause skin pigmentation abnormalities. Hyperpigmentation is a frequent concern for clients and is discussed in subsequent chapters. Hyperpigmentation appears in the following forms. Melasma is a type of hormonal hyperpigmentation disorder that first appears during pregnancy or with the use of birth control pills. Melasma has an identifiable pattern of solid, fairly symmetrical hyperpigmentation, often on the forehead, cheeks, upper lip, and chin. Sun exposure can exacerbate the pigmentation of melasma, so a person may have melasma and sun damage. Addressing the symptoms of melasma can be a challenge for an esthetician. The pigmentation can fade during Addressing the symptoms of melasma can be a challenge for an esthetician. The pigmentation can fade during times of low UV exposure. I also have a glare issue here. I need to close the curtain. Types of hormones returning to normal levels after pregnancy will alleviate the pigmentation. The consistent use of melanocyte inhibiting skincare products as well as sunscreen application is essential. A series of chemical pills can lighten the pigmentation. Some high-energy laser devices with nanosecond or picosecond technology and fractional radiofrequency treatments can offer visible improvements. Melasma is a condition that requires management. There is no cure. Lentigo is a flat pigmented area similar to a freckle. Small yellow-brown spots. Lentiginans are multiple pigmented lesions. Medical professionals identify lentigens that result from sunlight exposure to actinic or solar lentigens. Your clients may call them age spots as they are associated with aging skin. Epielids, also known as freckles, are tiny, round, or oval pigmented areas of skin on areas exposed to the sun. Also referred to as macules, they are small, flat-colored spots on the skin. Nevus, also known as a birthmark, is a malformation of the skin from abnormal pigmentation or dilated capillaries that is present at birth or appears shortly after birth. A port wine stain is a vascular type of nevus. Figure 4-12A is an example of a pigmented nevus. Figure 4-12B is an example of a vascular nevus. Poikiloderma of Sivat is a skin condition caused by actinic bronzing, chronic sun exposure to the sides of the face under the chin. Poikiloderma, that's kind of challenging, is benign, meaning it is not cancerous. Treatment can be a combination of melanocyte inhibiting skincare, chemical peels, advanced treatments with lasers, and IPLs, consists of consistent sunscreen protection and avoiding irritants such as heavy fragrances on the skin. Then post-inflammatory hyperpigmentation, known as PIH, is darkened pigmentation due to an injury to the skin or the residual healing after an acne lesion has resolved. Figure 4-13. It is often deep red, purple, or brown in appearance. And if you are just listening, there are pictures of these on page 143. You can pause the video, go back, watch it again. But if you're driving, no looking. Tan results from exposure to the sun. Tanning is a change in pigmentation due to melanin production as a defense agent, UV radiation that damages the skin. A tan is basically visible skin and cell damage. Hypopigmentation occurs in various forms. It is seen less commonly than hyperpigmentation disorders. Leukoderma is a loss of pigmentation leading to light, abnormal patches of depigmented skin. It is a congenital disorder acquired due to immunological and post-inflammatory causes. Vitiligo and albinism are leukoderma. Albinism is a rare genetic condition characterized by a lack of melanin pigment in the body, including the skin, hair, and eyes. The person is at risk of skin cancer, is sensitive to light, and ages nearly without normal melanin production. The technical term for albinism is congenital leukoderma or congenital hypopigmentation. Vitiligo is a pigmentation disease characterized by white, irregular patches of skin that are totally lacking pigment. Figure 4-14. The condition can worsen with time and sunlight. The disease can occur at any age and is believed to be an autoimmune disorder, causing an absence of melanocytes. Tinea versicolor, also called pityriasis versicolor, is a fungal condition that inhibits melanin production. It is not contagious because it is caused by yeast, a normal part of the human skin. It is characterized by white, brown, or salmon-colored flaky patches. Sun exposure can stimulate the growth of the fungus. This fungus can be treated with antifungal cream or other medication. Selenium sulfide shampoos can also treat the condition. High humidity and summer heat stimulate the condition. It usually fades in the cold winter season and reoccurs with warmer weather. To the layperson, tinea versicolor can be misinterpreted as vitiligo, so referral to a medical professional is important. Check-in. List 3 disorders characterized by hyperpigmentation. Describe tinea versicolor and its treatments. Describe the different types of dermatitis. Dermatitis is a generalized term to refer to an inflammatory condition of the skin. Various forms include lesions such as eczema, vesicles, or papules. Dermatitis has many forms and symptoms of one form can be confused with symptoms of another form. Referral to a medical professional is recommended for appropriate diagnosis. Types of dermatitis or inflammation of the skin include the following. Contact dermatitis. Occupational disorders from ingredients in cosmetics and chemical solutions can cause contact dermatitis or dermatitis veneta. Contact with allergens and caustic chemicals can cause skin sensitivity or disorders. Allergies and skin eruptions are common. Wearing gloves or protective skin creams while working with chemicals or irritating substances can help prevent contact dermatitis. Allergic contact dermatitis. Allergic contact dermatitis is caused by exposure to a direct skin contact with an allergen. Normally, the immune system protects us from pathogens and disease, but with an allergic reaction, the immune system causes the problem by trying to do its job too well. An allergic reaction occurs when our immune system mistakes a benign substance for a toxic one and initiates a major defense against it. Initial exposure to an allergen does not always cause an allergic reaction. The development of hypersensitivity is a result of repeated exposure to an allergen over time. This process is called sensitization, and it may take many months or years depending on the allergen and the intensity of exposure. Also, remember that different people develop allergies to different allergens. Individual predisposition to allergies may be inherited. Sensitivity seems to run in families. Contact dermatitis and red itchy skin can be caused by an allergic reaction or contact with an irritant. Caution: the following reactions from chemicals are commonly seen in the salon: on the practitioner's fingers, palms, or on the back of the hand; on the practitioner's face, especially the cheeks; on the client's scalp, hairline, forehead, or neckline. If you examine the area where the problem occurs, you can usually determine the cause. For example, technicians may react to chemicals in disinfectants or strong skincare products. This is both prolonged and repeated contact. Sensitization is an increased or exaggerated severity to products. Wear gloves to avoid potential reactions. Eyes and lungs can also be affected by exposure to strong chemicals or other ingredients. Contact dermatitis, red itchy skin, can be caused by an allergic reaction or contact with an irritant, such as these common allergens: makeup, skincare products, detergents, dyes, fabrics, jewelry, plants, red dyes in products, nickel in jewelry. Atopic dermatitis is a chronic relapsing form of dermatitis. Atopic means excess inflammation from allergies. Irritants and allergens trigger reactions that include dry, cracked skin. The redness, itching, and dehydration of the dermatitis make the condition worse. Use of humidifiers and lotions can help keep the skin more hydrated. Topical corticosteroids can relieve the symptoms. And there are pictures on this page, if you are able to look. Eczema is an inflammatory, painful, itching disease of the skin. Is acute or chronic in nature and has dry or moist lesions. A client with eczema should be referred to a physician. Avoid contact and skincare treatments if a client has eczema. Irritant contact dermatitis. Everyone who comes in contact with an irritant is affected by irritant reactions, although the degree of irritation will vary depending on the individual. In acute cases, symptoms are noticed immediately or within just a few hours. Chronic cases may be delayed reactions that take weeks, months, or years to develop. Symptoms range from redness, swelling, scaling, and itching to serious, painful, chemical burns. Irritating substances temporarily damage the epidermis. Caustic substances are examples of irritants. When the skin is damaged by irritating substances, the immune system springs into action. It floods the tissue with water, trying to dilute the irritant. Therefore, swelling occurs. The immune system also releases histamines, which enlarge the vessels around the injury. Ugh. Blood can then rush to the area more quickly and help remove the irritating substance. The extra blood under the skin is easily visible. The entire area becomes red and warm. It may also throb. Histamines cause the itchy feeling that often accompanies contact dermatitis. After everything calms down, the swelling will go away. The surrounding skin is often left damaged scaly, cracked, and dry. Fortunately, irritations are not permanent. If you avoid repeated and or prolonged contact with the irritating substance, the skin will usually quickly repair itself. However, continued or repeated exposure may lead to chronic allergic reactions and skin damage. You may notice irritant contact dermatitis when a teen client comes in for an acne consultation. You may note a breakout on the client's chin and learn that they play football. You must rule out the possibility of irritant contact dermatitis from the football helmet chin strap before beginning a treatment plan for the acne. Perioral dermatitis is an acne-like condition around the mouth, consists mainly of small clusters of papules. It may be caused by toothpaste or products used on the face. It is not contagious. Antibiotics can help treat the condition. Seborrheic dermatitis is a form of eczema characterized by inflammation, dry or oily scaling or crusting, and or itchiness. The red flaky skin often appears in the eyebrows or the scalp and along the hairline in the middle of the forehead and along the sides of the nose. One cause is inflammation of the sebaceous glands. This condition is sometimes treated with cortisone creams. Severe cases should be referred to a dermatologist. Stasis dermatitis is caused by poor circulation in the lower legs that can create a chronic inflammatory state. The legs may sometimes have I have the watery eyes again. The legs may sometimes have scaly skin, itching, and hyperpigmentation. The hyperpigmentation is caused by hemosiderin staining, a brownish, reddish discoloration due to iron deposits in the blood leaking into the tissue. A client with this type of skin disorder needs a cardiovascular referral. Even when the circulatory issues are resolved, the hemosiderin stain can remain. Advanced aesthetic treatments with IPL can help improve the appearance. And there are pictures of these conditions, page 147. Did you know poison ivy is a common allergen? Although approximately 75% of the population is allergic to poison ivy, the remaining 25% will never have a reaction no matter how many times they are exposed. Individuals who are not predisposed never become sensitized and will not develop an allergic reaction. Check-in. List the inflammations of the skin. And that will do it for this video. Please comment, like, share, and subscribe. And check out my other videos. We will continue Chapter 4, Disorders and Diseases of the Skin, in upcoming videos. I hope this was helpful to you. I appreciate you watching and or listening. And have a great day. Thanks. Bye.